Welcome to DermTV Viewer Question Week for October 2012. Today's episode will feature questions from DermTV YouTube viewers. And don't forget, as part of Viewer Question Week, I'll be answering questions over live streaming video at beautyrxlive.com. So if you have a question, tune in this Wednesday at 2 p.m. Eastern Standard Time. Hello, I'm Dr. Neal Schultz, and welcome to DermTV. Our first question today comes from Lefty La. Hi, doctor. Are there types of dark spots that hydroquinone can't lighten? It doesn't seem to be working on my sunspots. Thanks. Different types of browns are caused by different things. There's a difference between just plain hyperpigmentation, which is flat pigmentation in the skin, and things like sunspots, which have many different layers of dead cells with extra brown pigment in them. And the problem here is that if you're only using a bleach like hydroquinone, it's not doing anything, number one, to get rid of the extra layers of dead cells that have brown pigment in them, and it's also not giving the hydroquinone a chance to penetrate down into the bottom of the epidermis where the pigment-forming melanocytes are. So you need to be using an exfoliant, and you know how I feel about glycolic exfoliants. I think they're the gold standard. You need to be using a 10, 12, or even 15% glycolic product every day to help peel off those extra dead layers of cells that have extra brown, and to enable the bleach, whether it's hydroquinone or a peptide-based bleach, to enable that bleach to get down to the melanocytes where they're making the extra pigment from. Age spots, which are also called sunspots, certainly require an exfoliant in addition to your bleach. Question number 2 comes from I'm Your Happy Drug. I was hoping you could offer some advice on how to treat a very dry scalp. Over the past few months, my scalp has become very dry and flaky. I've tried various anti-dandruff shampoos and conditioners to remove the dead skin. However, they seem to dry out my scalp more and make it incredibly itchy. What would you suggest? This gets back to the basic premise of, is it a dry scalp or is it dandruff? And actually what you're describing is dandruff. And when you have dandruff, it's caused by too much oil in the skin that can't get out of the skin, that is getting trapped in the skin. It causes inflammation. That inflammation causes a little bit of swelling, a little bit of redness, and then premature shedding of the dead cells. And when they come off too early, they don't fall apart like individual bricks from a brick wall, but rather they come off in large sheets, which we see as flakes, which would be analogous to a whole wall of bricks falling down. So the problem here is inflamed skin. And since we can't reduce oil production, which it's excess oil production, that's the problem here. Since we can't reduce it from the outside, we can treat the inflammation, reduce the inflammation, so you're no longer getting those large sheets of dead cells, but instead giving the skin a chance to mature and be shed as individual small cells that you don't see. For that, we use dandruff shampoos, which reduce inflammation in the skin. But certain active ingredients in dandruff shampoos work better than others. And I believe that tar-based dandruff shampoos and salicylic-based dandruff shampoos really are much better than the zinc and selenium and sulfur-based shampoos. So if you're having this problem, number one, it's not dry skin, it's dandruff. Number two, the itching is all part of it, and use either a tar-based dandruff shampoo or a salicylic acid-based dandruff shampoo. Shampoo every night. Lather up for a minute, rinse it out, and then lather up again for another half a minute. Or even better, use both of those shampoos, alternating back and forth each successive night between them, and I promise you in 10 days, your dry scalp, which is really dandruff, both that and the itching will disappear. This is a great question, but a tough name. But I think it's Pippin Angel Long Ding Dong. Thank you. Hi, Doc. Why do you think benzoyl peroxide is safe but not hydrogen peroxide? Well, that's a very interesting question. But don't forget, we spoke about putting hydrogen peroxide on open wounds and how it was injurious to normal cells. And also the fact that it releases an awful lot of reactive oxygen species, and much more and to a much greater extent than does benzoyl peroxide, which number one is not nearly as reactive, doesn't make nearly as much in the way of reactive oxygen species, and number two, you're putting that on the surface of your skin, not on a cut or an abrasion where it has access to deeper live tissue. So when you're using benzoyl peroxide on an acne lesion, whether it's a blackhead or a whitehead or even an inflammatory pimple or cyst, you still have layers of normal skin through which the benzoyl peroxide is partially absorbed and partially penetrates, but not nearly to the extent that the hydrogen peroxide, which has free access to all the normal tissue inside, which is exposed as a result of the abrasion or the cut. So we're really two different types of peroxides with two different potential reactivities with two very different access to live, healthy tissue. The next question comes from Sierra Bernadette. If you use self-tanner on your face, will it blend your pigmentation and make your face even, or will it make the discoloration stand out? Very simply, Sierra, if you haven't been exfoliated, then any place where you have extra dead cells, such as on the age spots that we discussed before, or on any type of thickening or thickening above an old acne spot which has turned dark, any place you have dead cells is going to pick up the self-tanner preferentially and turn even darker than the surrounding cells, surrounding skin, because self-tanner works on the basis of staining dead cells. The more dead cells, the deeper the stain or the deeper the pigment. So if you want to make sure that self-tanner makes your facial skin more even and doesn't make existing browns stand out, make sure you've exfoliated regularly for a few days before you use your self-tanner to get rid of any excess dead cells, and that will result in the self-tanner giving you a much more even color. However, since you've removed a lot of the dead cells all over fairly evenly, you may need to apply more of the self-tanner or apply it more often to achieve and maintain your tan, but you get a much more even tan. Next question is from Bethany14. Do I have to go to a dermatologist to get a skin cancer screening, or can my GP do it? Well, Bethany, that's such an important question, and while our GPs are the first line of defense, invaluable and so crucial to our health care, if you have a rash, you want to go see your GP, it makes perfect sense. But if you're going for a skin cancer screening exam, particularly if we're looking to see whether or not you have any precancers, which are much more subtle than an obvious and overt skin cancer, I believe that it's much better to have that screening exam done by a dermatologist. If you don't have access to a dermatologist, by all means, go to your GP. But if you do have access to a dermatologist, I think in the end you have the potential to have a more complete and much more accurate interpretation of anything that's questionable. That actually serves as a segue into the next comment. It's not a question, but it's a comment. But I feel because of the seriousness of the issue, and because of the way it's stated, that I would just like to read this comment to you and then add my own commentary. The Jules123 says, thanks for this informative video. My mom is in the very end stages of melanoma as I write this comment. We must spread the word. People think melanoma is just a spot on the skin to be cut off if it occurs. In fact, my mom's is in her liver, lungs, spleen, stomach, brain, genitals, and pelvis. Please be smart and educate yourselves, people. Nobody should have to suffer like this. The Jules123, our thoughts are with you. I understand, and I wish you every comfort that's possible. But for all of our DermTV viewers and YouTube viewers who you've been kind enough to share this with, this isn't coming from me, the doc. This is coming from one of you. Melanoma is not a disease that you want to have to cure or beat. You want to prevent it. I don't tell anybody not to go in the sun. I tell my patients how to protect themselves when they're in the sun. Every day, rain or shine, use a sunscreen with an SPF between 15 and 30 with UVA or broad spectrum protection, and reapply it every 2 to 3 hours and immediately after swimming or sweating, and you will be protected and you will do everything you can, and make sure you get an annual screening exam from a dermatologist to ensure the early detection of any precancerous lesions so they don't have the opportunity to go on and do what has been described in this poignant comment. Thank you. Please join me again at dermtv.com. If you have a question, please send it to me by visiting dermtv.com/question. I'm Dr. Neal Schultz, and thank you for watching today.